as women will go through menopause and perimenopause. So the focus of today's conversation is to destigmatize the subject, to provide information about nuances in treatments, and to empower women to be their own advocates when it comes to healthcare. So as a reminder here, this is all, we're having a conversation with some healthcare professionals, but as always, you are always to get advice from your personal doctors when it comes to your own healthcare. So this would not be possible without our guests today. So let me introduce you. Joining me today is Dr. Christy Blanco with integrative and personalized hormone therapy, practicing out of Santa Teresa, specializing in women's health. Also, Dr. Surisha Reddy. She is the chair and professor of obstetrics and gynecology at Texas Tech Health El Paso. Dr. Tijuana Norris, chief nurse practitioner at Emergence Health Network, and Pamela Sanchez, who is sharing her journey with us, her menopausal journey. I want to thank you all so much for being here today. So we want to go ahead and start things off with what happens before women go into menopause. What is perimenopause? And Dr. Blanco, I'll go ahead and go to you first.
Thank you so much. I really appreciate it. And thank you for having me here today. It's an honor to be here. Perimenopause. So this is a transitional time. Every woman will go through this. Every woman will go through this as long as we live long enough, right? And it is a transition where we're starting to change. Believe it or not, this is the only organ that does not make it. It just does not make it in our life. And it starts to not work properly, and over time, it starts to not work at all. And so what happens is our hormones start to decrease. And during this perimenopausal transition, our hormones change. And so perimenopause is before menopause. Before menopause. So once you have, when you go 1 year without a period, that is the definition of menopause. 1 year without a period. Prior to that time frame is called perimenopause. We have an early perimenopause transition and a late perimenopause transition. When we go through this early transition, what happens is our periods start to become a little bit irregular. Maybe we might be off about 7 days, but we're not necessarily skipping 2 months without a period. But we might start to experience some of the symptoms of menopause, like some hot flashes. When we start to go a little bit later into our perimenopausal transition, then what happens is we will go about 2 months or about 60 days without a period. And at that time, that could last for about 1 to 3 years until our last final menstrual period, which is when that will be the definition of menopause, when you technically can go 1 year without a period.
And Dr. Blanco, how young can a woman be when they go into perimenopause?
So that's such a great question. What age group? Because the number one problem that I see are women kind of complain, oh, I was told I'm too young. I was told I was too young. However, this can occur 7-10 years prior for an early perimenopause. The late perimenopausal transition can last about 1 to 3 years, but that earlier perimenopause can last several years prior to that. So the average age of menopause is 51, 52. That is the average age of menopause. And so if we kind of subtract that, anybody from about 45 to 55 can go through menopause. So if somebody's going through menopause, if somebody goes through menopause by the age of 45, and then we subtract several years, we could be looking into our mid to late 30s that a woman might be experiencing some of the early transition of perimenopause.
Right, and I think that's one of the most shocking things that a lot of women didn't realize, that you can start getting some of these symptoms as early as age 30. So perimenopause comes first, and then of course we go into full menopause. Dr. Reddy, talk to us about what that stage of full menopause is.
So as Dr. Blanco just explained, usually it's that 1 year of no menstrual cycle, of having that transition into menopause. So really, you haven't had a menstrual cycle. The menstrual cycles have stopped for the most part. maybe you've gone through this transition period that can last for quite a long time. If you started the transition maybe in your late 30s to even early 40s, irregular menstrual cycles are a significant portion of that. And then you go into this menopausal period where you've had no menstrual cycles. But during that time, there's so many other things that happen, and that menopausal transition can happen at 51, but can actually go all the way into your 60s. And those symptoms, outside of just stopping your menstrual cycles, kind of are like exacerbation of those symptoms that you've had before in the perimenopausal period, which is maybe that lack of estrogen. And that lack of estrogen could be so many things. Hot flashes are one of the most common symptoms that women have, and that sweating that women have. And that can lead to a whole host of symptomatology, including not being able to sleep. And you can imagine if you're experiencing it at 51, and that menopausal transition and the definition of menopause continues maybe for another 5 to 10 years, that's a lot of symptoms to have for a prolonged period of time.
Right. And Dr. Reddy, can a woman still have regular periods and still, still be on time monthly and be in the stages of perhaps perimenopause?
Yes. The physiology is pretty interesting around the perimenopausal period. I always warn women, you're still ovulating, so sometimes people say, I'm in menopause, even though they're in perimenopause, and they may not have had a period for maybe even 3 to 5 months, and all of a sudden they get a spontaneous period. And during that time, you might have back to your hormonal levels that you were. So they're fluctuating, they're going up and down. And it is very possible to ovulate and get pregnant during that time too. So birth control is still very important if you don't plan on a pregnancy. But in addition to that, it's pretty controversial whether we should be doing hormonal levels during that time, meaning, do you need to use hormones as a way to diagnose menopause or perimenopausal? Well, the hormones are fluctuating and changing, so they can appear normal even though you're having symptoms. So we shouldn't, with those hormonal levels, if they're drawn and if they're normal, that shouldn't deny you that symptomatology. So if you're experiencing perimenopausal symptoms and having normal hormonal levels, that could be part of the transitional state.
All right, and we will get to a lot of those symptoms in just a little bit, but for a lot of us who have done our research on, the hormones that play a role when it comes to menopause and perimenopause, we know that estrogen is obviously the main one. But Dr. Blanco, what other hormones are, what other hormones play a role in these stages?
So definitely estrogen, testosterone, and progesterone are probably the biggest ones. And so, and I think it's important to note that all women will experience a low level or, a decreasing level of estrogen, but not all women will experience hot flashes. So there's still a lot to know about this. And just because, somebody's estrogen is low on labs does not mean that they're in menopause or perimenopause. We don't diagnose it based on labs, because that's another problem that I see. Somebody comes to me with their labs and saying, I'm in menopause. But when you talk to them about their periods, then, it's a different story.
And so we know that some of these hormones would also play a role when it comes to our mood and our mental health. And Dr. Norris, maybe you can kind of chime in here a little bit as to how that affects us as far as how we're feeling emotionally.
Absolutely. So when we talk about the psychological effects that perimenopause and menopause have on you, they're going to be, your hormones are fluctuating wildly. So you have your estrogen and you have your progesterone, they're just up and down. And these hormones are not only responsible for our reproductive system, it's also responsible for mood, it's also responsible for regulation of sleep, the stress hormones. So things that you can end up feeling is you can have mood changes, you can be feeling depressed, you can feel down, you can feel anxiety. Some women complain about cognitive decline, if you will, brain fog. So those are the psychological effects that will happen when women are experiencing these things during those 2 phases, and it's mainly going to be perimenopause.
And so let's dive into the symptoms, right? I think this is what a lot of women, and probably a lot of women who are watching, if you're not going into menopause yet, it's kind of what we're a little fearful about. We hear the common hot flashes, but Dr. Blanco, what are other telltale symptoms of, okay, we're entering this stage?
Probably, definitely hot flashes, vasomotor symptoms, night sweats, which is going to be a hot flash at nighttime. But one of the biggest issues that I see is they just don't sleep well. If they're not sleeping well, then that can affect their mood. That can affect a lot of other areas. It could affect, anxiety, depression as well, and accelerate that. But definitely, I would say vasomotor symptoms are pretty common. And but sleeping is a terrible issue. Women have trouble falling asleep. They have trouble staying asleep. They wake up at 2, 3 in the morning, cannot go back to sleep. And it can affect their cognitive, their brain fog that they complain about. It's been associated with weight gain, fatigue. It's definitely probably one of the bigger items. And it can also cause issues associated with migraines. And so that to me is probably one of the biggest areas that truly is bothersome for my patients. It's the lack of sleep.
And so how much of this do you think is being ignored by women, right? I think a lot of times we think like, oh, we lead some busy lives. Maybe we're just tired because we work too hard. At what point do women really need to say, okay, this is no longer normal?
Mm-hmm. So that's such a great question, and I think first of all, talking to somebody who specializes definitely in menopause, or your primary care provider, I think that's super important to discuss that with them. But when it starts affecting your life and your mood, and you just start not feeling like yourself, that's the number one thing. When a patient walks into my office and says, I just don't feel like myself, I know they're already starting in that transition. A lot of women, just validation alone can help. Just the fact that they know, like, oh my God, it's really happening. I'm transitioning. Okay. And so sometimes validation alone is helpful. And just talking amongst other women that they're all pretty much, not everybody, but definitely up to 80% of women experience symptoms of the menopause or perimenopausal transition. And talking to a support group, talking to your friends about it.
Right, I think that's a huge thing, and also a lot of feedback that I've gotten from women is exactly that, is they don't start feeling comfortable about talking about it until someone, says, oh, I woke up and it was drenched in sweat, and then, oh, like that happened to me too. And when we start creating this community of women who finally begin talking about it, I think that's when kind of like a little light bulb sets off that says, okay, something is not okay. Dr. Reddy, so estrogen plays a huge role in, I was surprised to find out, a lot of organs in our body, which is the reason why we get a lot of these crazy symptoms. Talk to us about exactly what the role that estrogen plays when it comes to, our bones and our brains, really everything, right?
Absolutely. We were talking about our cognition in our brain. The hypersensitivity of the nerves when you don't have the estrogen goes up. So sometimes, we may get a little from our spouses, why are you a little emotionally unstable here? Yes. And part of that is they that hypersensitivity. Exactly. And so, and the fluctuation in itself makes you go up and down. So you can imagine that the brain is very sensitive to that. The heart, a lot of the original studies that looked at the benefits of hormonal replacement therapy were actually, does it have some benefit to the heart? And now we have some pretty good evidence that if you start hormonal replacement therapy early, before heart disease really takes an effect, there may be some good benefit to the heart. The bones, I would say the single biggest impact is the bones. It is the primary therapy that's beneficial for bones. I can't stress that enough. We'll be talking about the Women's Health Initiative, and I actually grew up as a young physician in that Women's Health Initiative, and prior to that, when I was in training, hormone replacement therapy was the go-to for a lot of things. The Women's Health Initiative was a long-term study that took place after 2 years. It was stopped because there was some indication that perhaps there was an increase in breast cancer. It was originally designed to show, does it improve heart disease? But they found all these other findings, and as a result, overnight, prescriptions for hormone replacement therapy were stopped. And we've had to sort of be in this limbo for the last 24 years and do some additional studies and continue to look at the Women's Health Initiative, and there's been some criticisms over it. But the heart was one of those things. The bones, the benefit, the improvement on the colorectal cancer rates if you're on HRT shows some benefits. And then all the other benefits about collagen increasing. So on your joints, it also improves with hormone replacement therapy. So there's quite a lot of impact after the Women's Health Initiative, and unfortunately the decline of the use of the HRT. For the last 2 decades.
And we'll definitely get to that study in just a little bit, because that has obviously made such a difference in how women are getting care now. But I want to go to Pamela now, because you shared part of your story with me, and talk to me about what you noticed and what were some of those telltale signs for you that, okay, something's happening, something's different with me.
Yes, basically after 45, that's when I began to feel a lot of fatigue. I didn't feel like myself. A lot of brain fog at work. I was always, getting things confused. That was my worry most of all, because I've always been very focused and very active. And during this time, I experienced a lot of brain fog, midday fatigue, very, very tired. And I was not aware what was happening. I was always just cranky, and a shift did take place within me, because I just didn't feel like myself at all. And I was always looking, maybe caffeine. I needed caffeine.
Yeah, we've lived on coffee.
Supplement too, and I tried everything, and I would exercise as well. But I was also tired sometimes to exercise, so that took a toll after 45, basically.
And how much at that point did you know about menopause?
Some friends and I would talk about it. A group of friends, they were a little bit more ahead than I was. They were going through it, and to be honest, I was in denial. I said, I'm never going to get it.
Yeah.
I think it was basically because of age. And I said, I feel great. No, I don't. I do. So I was not much aware of it until I am now, until I went to the doctor.
Yeah, so Dr. Marie Claire Haber, and I know you all have probably heard about her. She's kind of been this pioneer doctor who has catapulted the talk of menopause onto not just social media and making sure that the word is out there, but also, we now have documentaries that are talking about this. And this question is for both Dr. Reddy and Dr. Blanco. Do you think that women's health has been not just understudied, but also under talked about?
I agree. I couldn't agree enough, actually. And I appreciate patients that come and advocate and are able to express all the symptoms that they're having, because what it does is bring about an awareness. And with patient advocacy, both from a physician level, but yourself as a patient should be able to feel free to be able to express these symptoms. Often we'll hear, menopause is normal. Yes, it's common, it's supposed to happen, it's a transition. But the symptoms that we're having can be these extremes where they impact our quality of life, and that's not normal. We should be able to go through life, and the reasons are, we have studies that show, are there therapies? Are there things that can make our lives a little better? And those are the questions we should get to. And yes, your question to, do we study enough and not study enough? I agree. Women's health, there should be more research into women's health. And I think having discussions like this, there's actually been several state initiatives, partly because of the lack of insurance coverage on some of the hormone replacement
that's something
therapy.
that a lot of women are now being very vocal about.
Exactly. And now, interestingly enough, in the last few months, there's been a shortage of hormone replacement therapy now that there's this uptick of discussion and talks, both on social media. And so I applaud you, Jessica, for having this talk this week, because I was wondering, where was Texas in all of this discussion, other than Marie Claire? That's one person, but we need a lot of discussions, both from a patient level and a provider level.
Yeah, and you can go ahead and chime in. It's so important. And for those of you who don't know who Dr. Marie Claire Haver is she's also a doctor who has, like I said earlier, become this pioneer of just spreading the word, making sure that, this topic is not stigmatized, that we're not gaslighting ourselves into what we're feeling. And it has really kind of catapulted, and opened the conversation. Luckily, we have social media now, right, where we could get a lot of that education from. But yeah, what are your thoughts on that, Dr. Blanco?
So social media has actually been incredibly helpful for women to get their word out, and I do want to point out too that women have been excluded relatively from research studies because we have the ability to get pregnant, and nobody wants to have us necessarily in a research study for that purpose. It wasn't until about, I believe it was the 1990s, when the Institute of Health pretty much said, from now on, we need to make sure that women are included and that we have an understanding which group are women and which group are men. And we know that the sex hormone, which is in every single cell of our body, can affect this. For instance, women experience heart attacks different from men. So we are behind in studies as far as for women, but I am really excited to see, because I do feel that this is probably, social media was probably one of the biggest impacts in hormone replacement therapy, getting that out there about menopause, and especially helping remove the black box warnings against hormone replacement therapy.
Right. So I want to go back to some of these symptoms, because the basic symptoms, right, of like the hot flashes, the fatigue, the lack of sleep, is something that we can all recognize. But there are also other symptoms that just seem either like they're not real, it's weird. Let's talk about some of those. And Pamela, maybe you can tell me if you experienced any of this weird stuff. We've been reading up on cold shoulder syndrome or something like that. Your skin and your ears itching, a change in body odor, changes of taste or smell, a histamine intolerance. Again, we'll go back to the anxieties and the heart palpitations that we feel. Some women have cold flashes instead of hot flashes. Did you experience any of these other weird symptoms?
I did. I would experience cold flashes more than hot flashes.
Right. Yes, I do too. No, which is great, because I'm always sweaty and all of a sudden I'm cold, and I said that's a little weird.
Any other symptoms that are on this list? No, but more sensitive to taste and smell.
Okay.
That occurred, yes.
Okay, and Dr. Blanco, maybe you can explain why some of this happens, or maybe what you're seeing in your practice that women aren't recognizing.
So, I don't have quite an explanation for this, and I'll tell you why, because there's not a lot of research studies on this, but every single weird symptom that a patient complains about, I tell them, you know what, let me look it up. And I look it up, I'm like, my God, it is associated with menopause and perimenopausal symptoms. So there's a lot of the times, because we're still pretty behind in the literature and the research. You know, yes, we can blame it on changes in your hormones as the probable cause of this, but to get to the true pathophysiology, we don't know yet.
Yeah, Dr. Reddy, would you want to chime in? I know,
Yeah.
like for me, I did have a bout of like itchy skin
Yes.
to the point where I was scarring myself because,
Yes.
and I was trying all the things like antihistamines and drinking the nettle, you know, the nettle leaf tea. It was so uncomfortable. Like I literally scarred myself, scratching myself, and I didn't know what, I mean, is that,
Yeah.
how is that associated?
Yeah, so estrogen actually stimulates collagen production.
Okay.
So, and so when you have these decreasing levels, collagen actually decreases. So you can actually get thinner skin as a result of it. Thinner skin can also result in drier skin. And so that's when that itchiness happens. And you'd be surprised how many women actually talk about itchy skin, and we think it's eczema, we think it's other things, but it's actually likely due to the decrease in the collagen production. So it's really important to use all those emollients, and hormone replacement therapy does help. But the cold shoulder is actually a really interesting finding also because joints are actually have a lot of collagen within them.
Yeah.
And so the cold shoulder is a very specific symptoms, and even people progress to frozen shoulders. So, and that happens also in the knees as well. So all driven by estrogen and decrease in collagen production.
Right, and Dr. Norris, so we've talked obviously a little bit about the cognitive changes that happen during menopause, and I think for a lot of women that is one of the most debilitating symptoms, right? Like not being able to remember everyday things, especially in your everyday life, dealing with your kids and dealing with work. But how can women navigate through this time, especially if you are already suffering from, say, depression and anxiety prior to coming into this stage?
Yeah, so women who are already having these issues, they may have a diagnosis of bipolar, they may have a diagnosis of anxiety, major depressive disorder. So things that the woman can do is that one, like Dr. Blanco say, you know, you want to get a group of people around you, surrounded, and have those people surround you and not have negative entertainments of energy around you, right? So the other thing that you might want to do is you want to get enough rest, you want to get enough sleep, you want to hydrate properly, you want to have a proper nutrition. Those are all the things that women should they should actually be touching on to address those symptoms and get ahead of them. One other thing is that they could look into medications. You know, these symptoms of perimenopause and menopause, a lot of times they exacerbate conditions that are already there. So they may look like an overlap of something that's already there and going on, and it aggravates that. And so SSRIs, SNRIs, you may want to try those type of medications. Fluoxetine, you can try escitalopram. There's also bupropion for that cognitive fog that women have. The cognitive fog is one of the main things that I hear a lot of women talk about.
Yes.
And high performing, high functioning women, women that are in executive roles or doing things like that, that's the one that really gets to them because it can be embarrassing. And they walk into a meeting, they can't remember. So there are a few things that they can do to address those.
And so the medication that women can take for anxiety and depression, can that safely, and of course everyone is on a individual basis, but can that safely be taken with hormone replacement therapy?
Absolutely, yes. They can absolutely take those medications with hormone replacement therapy. What happens is when they go to their provider, the PCP is going to be looking at, okay, let's find out what the root cause of this is. Where's these mood swings coming from? What's happening here? And so the medications that are being taken for the hormones, right, is going to address the hormonal issue. But if we have some, psychological issues going on, then those medications are going to address that. So you can absolutely do it. And in fact, sometimes if I have a woman that comes to me for a diagnosis of anxiety or depression, they may be going through menopause. My medication of choice might be venlafaxine, right? Because that medication is going to address those hot flashes for them. So they can absolutely do that safely. Yes.
Some women also have reported, obviously, a lot more intrusive thoughts during this time, to include something that we also don't talk enough about is thoughts of suicide. Have you, had any, patients, or what are your thoughts of what women can do about that? Because that's like the extreme, side of these changes.
Yes, that's the extreme side, and that's the side that what we don't want to do is we don't want to ignore it. And so any person, or woman I should say, who is experiencing suicidal thoughts, because they can increase during that time. It could even, a woman who has never had a psychiatric disorder can actually start having, depressed mood, and that depressed mood turns into suicidal ideations, and then the ideation turns into, the thought, and then now we have a plan. And so what women can do is, number one, there's 988, that a resource that they can call. Make sure that they're calling a crisis line. One of the other things that they can do is they can have the buddy system, have a friend, have someone to surround them, be with them, talk with them, go see their provider, number one. Let's see what's going on with it. A lot of times women who already have these conditions, it is going to exacerbate those. Women with the diagnosis of schizophrenia, we know that when they go through it, certain hormones are going to fluctuate or decline rather, and they may experience more hallucinations. So suicidal thoughts are definitely there.
Pamela, what would you say it was the most debilitating symptom for you?
Well, touching that subject on mental health, I remember I would wake up a little depressed, and I've never been a depressive person, and that I was not aware what was happening. I was just very depressed, and then it would go away. So I would say that, and also joint pain.
Yeah.
And then
Waking up achy.
Yes, and then swelling. I would, just feel swollen. I would eat certain foods and just swelling in my hands and body, and then weight gain after 48. I started a little bit, and then, but off and on, these symptoms would occur off and on, and they were just very confusing for me.
Yeah, so again, I think a lot of women they just say, like, I just don't feel like myself. We can't stress that enough. So I had the opportunity to talk to another woman. She's actually going through perimenopause. I want to introduce you to Beverly Trujillo. She recently learned that at age 45, again, she entered perimenopause, and she shared her story about the symptoms she knew she couldn't ignore and how she's now finding relief. Take a look. As we've discussed, the symptoms for women in menopause or perimenopause will vary. For 41-year-old Beverly Trujillo, a nurse in El Paso, even a medical background didn't fully prepare her for some of her perimenopausal symptoms.
Minor, small things that I just thought was nothing, like the urgency, urinary frequency and urgency that I hadn't even had since after my kids were born. And then the little light forgetfulness, but like, again, right, those are little things that you dismiss easily, like, oh, probably just need to sleep more, and the insomnia and just being so tired at work. And so these little things were creeping up. And I think up until a couple of months ago, what really kind of solidified it, I love hot showers. I love it. I can be in a steam room all day. I love hot showers. I became very heat intolerant. I couldn't be in a hot shower. I was taking cold showers in December.
Trujillo says the reality is that even women who come from a medical background can be caught off guard by what they're feeling or experiencing.
It's, some forgetfulness and anxiety. And I almost feel like those symptoms are like said so softly and brushed under the rug, like, oh, it's just a little change that your body goes through. But really, you should be sounding the alarm. It's like, it's not night sweats. It's like you're sweating profusely like you're dying. And the cycles are just heavy cycles, even though you've never had a heavy cycle your entire life.
And she says she wasn't afraid to start hormone replacement therapy even before she fully entered the menopausal stage.
I reached out to Dr. Blanco. I was like, I'm too young for this, aren't I? And she's like, no, you're right at that age. And I've noticed like a complete difference. And so that was reassuring to me to like, oh, okay, this is what it was. I wasn't going crazy, or I don't have a brain tumor. Because going back to the migraine headaches, that's something where you're like, oh my gosh, what's wrong with me? Is it something catastrophic? And then you just do some hormone replacement, and wow, you feel a whole lot better. I can sleep better. I have more energy. I don't have to like survive off of coffee all the time.
And as far as the symptoms that most affected her,
for me, it was the heavy menstruals. I'd never experienced that in my entire life. And I was telling my husband, because I started I started one of my cycles at work, and I had a full-on anxiety panic attack because I've never in my entire life bled like that. I thought I was dying. I'm like, the mental fog had just been very debilitating. I've been practicing anesthesia for the last 14 years or so, and I pride myself to being up to date with a lot of the literature and current reviews and things out there. And sometimes you're just looking at something and you can't figure out the name of it. Like you're looking at a plant and you're like, what's the name of that thing on the branch? And the word leaf just can't come to you. And so that's been sort of like one of those things where I said to myself, I can't believe women just push through this, where they just drink water and hope tomorrow is a better day.
Yeah, and women are pushing through it, unfortunately. And let's get straight to how can we find relief. Dr. Blanco, talk to us about the different forms of hormone replacement therapy that are available for women.
Of course, when we're talking about perimenopause, and Dr. Reddy had kind of mentioned this before, you have to consider 25% of, some of the studies have found 25% of periods actually are ovulatory. So if for whatever reason you're not using any form of contraception, it is a time that you can get pregnant. During the perimenopausal years, nobody likes to hear this, however, contraception, birth control pills work very well for a lot of the vasomotor symptoms. It actually even helps sleep. And and during that time frame, birth control pills or maybe an intrauterine, progestin device can also work really well too. And then, of course, after menopause, there is progesterone and estrogen. And, and a lot of times people use this word bioidentical a lot.
Yes.
And it it got out there a lot. And, what really did it was because of the Women's Health Initiative, No to Hormones. So women started saying, I want bioidentical hormones.
And what is that?
It's just a term. It is just a simple term, and it just basically means the way that your own hormones would react in your body, that's how this hormone would react in your body. It hits the same hormone receptors, and there are FDA-approved hormone replacement therapies out there that you don't have to necessarily get compounded. You can get from your regular pharmacy and have insurance pay for it. And and I think one of the best options is the estradiol patch, and then progesterone, oral micronized progesterone. Those two alone are incredibly helpful for most women postmenopausal. And I think just making sure it's just that transition from perimenopause to menopause to make sure, that's it. We don't have any risk factor of getting pregnant at all.
And Dr. Reddy, there is a difference in is there a difference in how these types of hormones work on our bodies? Because I know for me, I am a migraine sufferer of 25 years, and after consulting with my neurologist, he said, you can't. I haven't taken an oral contraceptive in years because of the higher risk of stroke and whatnot, because I'm a migraine sufferer. But he said a patch would be fine. So does that work? Do they work differently?
Yes, the dosage of the hormones are different. So in the oral contraceptive, it's a little bit higher than you would get in the hormone replacement therapy. So your neurologist is absolutely correct, and kudos, because sometimes you'll hear migraines and everybody's like, no estrogen at all. And actually it's the degree of estrogen that can exacerbate the symptomatology. And it's actually not all migraines. It's really the migraines with the auras that have a little bit higher stroke risk. So
I have those.
So
Unfortunately,
So it really has to be investigated a little bit more. So migraines with auras are a little bit higher category for these things, but your neurologist was very informed, so that's excellent that they said you should still be able to use some of the estrogen types.
And is there another group of women that cannot, that the risk is too high to take any type of hormone replacement therapy? What would be, the conditions under which they couldn't?
So the individual that may have a family history, maybe a genetic history, or own personal history of like what we call thrombotic risks, meaning they've had a pulmonary embolus, like they had a clot in their leg that might have dislodged, and those individuals would be contraindicated. And if they definitely have a genetic history, it runs in the family, that that they are a little bit higher risk for these blood clots. Definitely those individuals, we think twice about ever doing any type of hormonal replacement for those, or any hormones for that matter. And then, you know, the breast cancer risk is, it's pretty controversial. There are some studies saying, dependent on the type of estrogen, I hope you don't get a lot of responses to this. The literature is out there, especially for the GU symptoms of menopause. Some of these younger women who go through menopause early because of some of the chemotherapy agents, they go through some severe symptoms of menopause. And even in the literature, in those women, doing some low dose estrogen therapy for those women to help with their symptomatology is beneficial, and it's been shown to be beneficial, especially localized estrogen. So in the vagina, those women should be able to use estrogen replacement.
Some women might be concerned about any side effects with hormone replacement therapy, and I know from the feedback that I've gotten, the women who have gotten relief have said it's been a trial and error, so maybe like the first time around they might not feel okay, but what are some of these side effects that women might experience? Dr. Blanco?
So one of the things that previously that the FDA had said is we should start hormones at the lowest dose and start to go high. But now that black box has been removed, and it's more of a shared decision making between the provider, because I did find starting somebody on the lowest dose for a lot of women, especially when they've got a lot of hot flashes and they're truly suffering, it didn't really help. So we had to constantly keep going up. And so sometimes now what I do is I do not start at the lowest dose if they're experiencing such significant side effects. I will definitely start a little higher, and I tell them, especially like with estrogen or progesterone, estrogen, if it is a little bit too much, you might have some breast tenderness. I'm not causing you any problems though, but we'll just want to consider maybe decreasing the dosage. And maybe if it's a little too much progesterone, they might have trouble getting staying awake in the morning. They want to sleep in because they still feel a little groggy in the morning.
I just want to point out, I think that's a great point Dr. Blanco just brought up about the estrogen dose in general. The younger you are, a little bit more estrogen is what you need. So I'm so reassured that she said I start a little bit higher dose is great, because what you don't want to do is, bring everybody back every 2 to 3 months and keep increasing. And that's what you see women kind of go through. Well, it didn't really work for me. And that's because likely we were trying to be safe, but not necessarily needed to be safe. We could start a little bit higher. So it's a great point.
Okay. And Pamela, how did you finally find, did you have to go through a trial and error phase, and how did you finally get to that dose where you're like, okay, I feel better now?
Basically, for me, was the light at the end of the tunnel. I went to 2 specialists. I think I was still in denial because I did get my blood work back, and they said, you're at 0. Your estrogen, your progesterone, and your testosterone. So finally, a few months later, I decided to start taking HRT. But in 3, not the pellets. I started taking the progesterone separate, and then the estrogen patch, and then the testosterone in cream method. So that really brought my life back. And every 3 months, they're getting my blood tested, because I started to go low, so they increase the dosage on the hormone. So basically it brought my back life. And then also by adding supplements and changing my food options, that truly helped 100%, I would say.
Yeah, and we'll get, and we'll, because someone else is asking about the supplements, and we'll get to that in just a little bit. But, you know, some women are also afraid of taking testosterone. Like, oh, am I going to start like growing hair on my face? But like, what can you tell us about that and how it does help? And, you know, women are also looking into, you know, the pellets and that, you know, so just giving them the education of what all that means and how that can help. Dr. Blanco?
So testosterone is also a metabolic hormone, and so there is the global position paper on the use of testosterone in women, and it has been endorsed by 10 plus medical societies here in the United States, showing that testosterone can help with a hyposexual dysfunction disorder. And so that's specifically what it's intended to do, because sexual dysfunction, low libido, is a common complaint in women. And so unfortunately, there is no FDA approved testosterone therapy in women. So women are forced to use what a man uses. For instance, women use about 1/10 of what a man uses. So a lot of times I'll have like a woman get a pack, like a man would use one gel, and then have them use that one cream for 10 days, over 10 days. And so unfortunately though, insurance does not cover that because it is not FDA approved, but it is for low libido. And so it could play some other role. It has been shown to help in some studies in other areas, but currently right now, it is recommended for low libido.
So low libido is something that is also another very important and not talked about enough symptom of perimenopause and menopause. So I want to transition here because I think that brings us right into the men, right? I did have a lot of men reach out to me who were like, hey, you know, what about us? You know, we're dealing with our wives and our spouses and our significant others, and we're having to deal with the hot flashes, and they don't want to be intimate. What about us? So I want to show you here. I did reach out to a man on social media by the name of Jesse Robertson. He is, you know, I know that one thing stands true here. While men are complaining, you know, about us being maybe a little bit crazy while we're going through this time, they also want to learn about how to better support women, and they want to save their relationships, right? So again, I had the chance to talk to Jesse Robertson, and he is the man behind Husbands for Menopause. Yes, you heard it right. Husbands for Menopause. You can find him on TikTok, on Facebook, on Instagram, on YouTube. He is spreading the word about how to live harmoniously with women who are going through menopause. Take a look.
If you have a wife starting to go through menopause, here are 3 things that I would start doing yesterday.
Jesse Robertson has started a nationwide movement on social media with pages Husbands for Menopause, first educating himself and now men on how to better understand women going through menopause. And while he's not a doctor, he's done his homework, reading up and studying the biology of women and the impacts of hormonal changes on daily life.
One of the things that I've really learned that's been impactful for me is learning how this is impacting relationships, right? So, and that has become a real sort of tenet of Husbands for Menopause, which began as, you know, hey guys, this is what a hot flash is, or hey guys, this is what, you know, brain fog means. And that's important because I want guys to understand that. But what it has turned more into is this is impacting your relationship. This is actually increasing divorce rates, right? And this is something that doesn't have to happen.
With over 1 million likes on his combined social media pages and over 300,000 followers, Robertson is reaching men and getting feedback from those who may be frustrated or confused about their relationships with menopausal women. He says he's found mood swings and loss of sex drive to be men's biggest concerns.
One of the things that men just simply don't understand is that she is evolving, but they're not. And when she's evolving through this time and she's having a biological change, right? Not an emotional one. The loss of it's a biological change that she's going through. It's a physiological hormonal change. So men need to understand that this isn't something she just chose.
Tell me, what is one of the most interesting or shocking things that you have learned through all of this?
One of the first things that comes to mind is the symptoms themselves. So there are symptoms that I've learned about that I'm sharing with men that don't even sound real. They sound burning mouth syndrome, really? you know,
Yeah.
tinnitus or tinnitus, depending on how you pronounce it, but ringing
The
in
itching of the
ears,
ears. Yeah.
itchy ear canals. I think so many things. If a man knew anything about menopause, he probably would have known something like hot flash, right? But even a
Yeah.
hot flash is something that I had to learn about with respect to what it actually is. And even that was shocking. I've learned what I would at least consider some shocking things about men. There's just, there's a few
That
things
was going to
about
be
them.
my next question, actually.
Okay,
What
well,
have
let's
you
get
learned
into
about men?
because I didn't realize that there were men out there who would say, well, oh, so this is what's happening. Well, I'll just trade her in for somebody younger then.
I think I've also gotten, some feedback from men who, they feel very much, I don't want to say the victim, but they're like, okay, but what about us, right? Like we're going through it too. Like I feel sad when my wife doesn't want to be intimate. I feel angry when my wife yells at me for whatever reason. Like we're going through it too. This type of understanding of trying to be, like men also want the empathy as well.
Yeah. And so I love what you just said, because it's something that I've been trying to talk to men about a lot, which is what you said was, I feel this way, right? Talking from the man's point of view, it feels like when this is happening. Yeah. That's such an important way to get through this, because what men are often doing, even though they feel that way, what they're saying is, I don't like it when you do that. That was messed up. That was wrong, right? And even though what they're feeling inside is, it hurts me. It makes me feel like you don't love me. It makes me feel like, you don't, want to be with me anymore. That kind of thing. That's the feeling that they have. But the struggle is they don't have the capability to express that in the form of feelings.
All right, and I think we can all chime in on that. But Dr. Norris, how important is it to make sure that we are keeping these communications open, with our families and our husbands? Because really these changes in our emotional state does affect, not just our places of work, but our family. I mean, in talking with Beverly in that interview, we were discussing something interesting, which was that for some of us women, we're exiting stage right as far as like we're entering menopause, while some of our teenagers are just starting, their hormonal periods. And, that's what I'm dealing with at home. So it's like a clash of hormones in the household. But how important is it to keep these conversations open and being open and honest with especially our significant others? Divorce rates are going up during this time. Talk to us about that.
Yeah. So it's actually funny that you say that, and from the clip that I just saw, I was actually talking to my mother last night, and we were laughing on the phone, and I don't think I've laughed that hard in a long time. And when I mentioned she didn't know I was going to be here, the topic of menopause, it was almost like she had PTSD.
Oh my gosh.
She immediately just started rambling on, and she said that was horrible, it was a monster, and she even said, you know what? She said, I'm not surprised if people have divorces over this.
Yeah, and studies show that it does happen during this time.
It is absolutely important to keep our lines of communication open, because we as far as the person that's supporting the woman needs to be able to support her by speaking calmly, speaking clearly, ensuring that the tone is right, because we can have crossfire of miscommunication. It's important to make accommodations if you have an employer to work at work, and small accommodations. It can really make or break relationships. Menopause happens at a time when life things are happening. Like you said, you have the child at home, or you have children that are leaving home. You're a caregiver to your parents maybe. You're maybe having changes in a career stress. So there's a lot going on during that time. So it is extremely important to be open, be honest, have the conversations with one another, and address it just head on. I mean, you have to have that conversation, because it will ruin.
Yeah, I mean, I think even at work, and I'll share something that even with me, right, I feel like I work a very high stressful job, and there did come a point where I had to walk into my boss's office and say, I don't know what's going on, but like I can know, like now when I'm researching stories or when I'm investigating and numbers and all of that overwhelms me all of a sudden, right? And I'm 45 now, and I know I'm going through those changes, but it was something that was very, I was afraid that I could no longer do my job. And I've never, if there's one thing I thought I did well was, do my job well. So I did have to have that important conversation. And I think it's important that all of us women do that. Luckily, I have a boss who's super understanding, she's going through the changes as well, and could understand that, hey, I may not be functioning, the way that I normally do. And I kind of don't know why, but I'm going to work on it. And, I'm sorry. Pamela, you said that your husband was super supportive, right?
Yes, I think we learned together this journey. He's been supportive, very patient, and now we talk about it. He even shares with me podcasts or information, and he even tells his friends, he advocates for this, and he truly believes that it is a support system.
Yeah, when I started watching Jesse's videos, I said, and even in that interview, I said, oh, your wife must just love you, right? Because she's doing all this homework. But Dr. Reddy and Dr. Blanco, I don't know if you want to chime in as well on like those effects of really on relationships and how women, it's not that we don't want to continue our intimate relationships with our significant others, we just can't help it, right?
Yeah, I really like the fact that we're bringing this up because there's been quite a few recent studies about the transition into menopause and workplace and the impact on women and their careers in this setting. They're trying to understand what's happening to them, but can you imagine without education how the workplace is reacting to them too? Yeah. So I'm glad we're having this conversation to educate people that we should have that support systems in place, and these are great examples of thoughts about how individuals, both in the workplace, having open conversations and talking about how it impacts us.
Yeah, and I agree. And we're all women, we all experience this. I'm experiencing this too. My daughter's going through puberty, and I'm ending it. And so the household is a little crazy.
Exiting stage right, entering stage left. Yeah.
Like I'm still learning how to handle your hormones and handle my own hormones.
Right.
So I totally understand it, but you're not alone. 30% of women have experienced issues in the workplace wondering, can I continue to do this job? Do I need to find another job? And there's times, just me, I've got so much going on, people coming at me, patients coming at me, this, my medical assistant, all this stuff. Yeah. And I'm like, please God, I can't handle this. I can't handle stress like I used to.
Right.
And I know that. And it's just, and some days my brain is not working. And I have to tell myself, okay, God, my brain has to work today. Please remove this fog. Do what we need to do because it can just happen. And because we have so many people relying on us. And we just have to get past that day.
Yeah, and it's like we have to continue doing what we're doing, being moms, being workers and whatnot. I wanted to ask you. So that we had a viewer actually chime in asking about vitamins and if there are any supplemental vitamins that women can take. But also on that note, can women go through this phase without hormone replacement therapy? For those who say, I don't want anything to do with hormone, I don't want a hormone in my body, what can I do naturally to survive this time? Dr. Blanco?
So these are all such great questions. So the big thing is supplements, vitamins. If somebody is deficient in a vitamin, I absolutely do recommend it. There's no doubt. And but to really say that there's research to show that yes, certain vitamins can help, absolutely, not necessarily. However, if we're a little bit deficient, yes, I do recommend a lot of vitamins. Vitamin D, I mean, almost everybody I feel like I measure is deficient in vitamin D. Yeah. D as in dog. And so yes, there are those. And I find if a woman does not want to take hormone replacement therapy, usually I sit down with her and I find out why. Mm-hmm. What is it? And usually it might be the fear of breast cancer or the fear of something. So I sit down with them and I talk to them about the research. and how a lot of this was overstated. And I break it down for them, and then I let them decide, is what I usually do.
Dr. Reddy?
Yeah, I agree with Christy, and sometimes there's some stuff saying, obviously, regular exercise, even during this time when we're gaining a little bit more weight and our metabolism is going down, definitely some stuff that says some of the symptomatology can improve with exercise. And then we bring up all the different symptoms. There's non-hormonal options for some of the new symptoms. Some of the recent research of using the neurokinin B inhibitors for hot flashes. So there are some medications that are non-hormonal for hot flashes, which then might improve your sleep also. And so there are some ways to kind of go around the hormone replacement therapy, providing that might be individual symptoms, and we can use some of these non-hormonal options for those.
Pamela, did you find anything other than, things that worked for you?
I truly am a 100% believer in supplements. I mean, hormone therapy as well, but combined. For me, ashwagandha, the black kakash, and inositol, these even, they were approved by my doctor. These have been a great help for me, even for focus, lion's mane. So I've tried options, even teas, more than coffee, to lower the magnesium, to lower your cortisol at night, less caffeine. So yes, I have received benefit from
And real quickly, black cohosh, is that how you say it? Black cohosh is something that I know some women mentioned as well in some of the comments I received. Has there been any studies, medical studies on that, Dr. Blanco? Or Dr. Reddy?
Yeah.
Whoever wanted to go first.
I mean, we have seen it. Unfortunately, a lot of the research does not show to be beneficial when compared to something like an SSRI, paroxetine. However, I mean, and I'm sure Dr. Reddy's seen this, even though research says this, it doesn't necessarily mean that it doesn't necessarily help somebody, because I've seen a lot of women, they take it and they're like, I feel some relief. And to me, I think that's the most important item.
Yeah, and there are some small amounts of phytoestrogens in all of those compounds. So if somebody has a lower threshold, that can certainly benefit from that. So I never discourage that, because we've seen efficacy in some of these individually, but maybe not necessarily in these larger trials. But I would never discourage anybody from taking these things, because I think there is some truth to people's experience and how they experience taking the teas, taking the supplements. There's some great data on lion's mane. There's actually some great data on magnesium supplements.
Oh, magnesium.
And so,
I love
magnesium. So, and especially magnesium supplements in cognition too. So I would certainly recommend those.
And Dr. Norris, I don't know if you also want to chime in maybe with some of the things that can help us to de-stress, anything more of the natural route?
Yeah, I mean, anytime we do exercise, increase our activity, that's going to speak to our serotonin levels. Anytime the foods we eat, you want to eat brain healthy foods that kind of help guide that. Meditation, be prayerful. You could do a therapy, CBT, maybe beneficial to individuals. So there are a lot of things that you can do that you don't necessarily have to take hormones or medication for.
All right, so we are I know this was going to be just the tip of the iceberg when it came to this, and an hour was not going to be nearly enough to discuss all of the things that come with this subject, and maybe we will have a part 2. But before we go here, I do want to give everyone the chance to give us maybe some resources that women can look into. We know that insurance and insurance coverage is one of the big things that women have, are very concerned about, of I want the help, but I can't afford it. It's very expensive. So we'll kind of go down the line here, and just maybe you can quickly talk about some of the resources.
Well, as far as insurance, I think making sure that you have a office that is willing to do prior authorizations. That's going to be the big thing. If you're not obtaining these hormones from an office that is not willing to do a prior authorization, then that might be the wrong office, because that's the number one thing, because I can get a lot of them through. And then, there are some other options out there, like for instance, that are online pharmacy Amazon, Cost Plus Pharmacy through Mark Cuban that I've gone through that are they're pretty cost effective, and that they don't go through insurance. So I look into a lot of items like that when it comes to not being covered.
Okay. Dr. Reddy?
Yeah, I agree with Christy, and also look at some local pharmacies as well. There are some great local pharmacies that the pharmacists have heard from patients, and they're trying to advocate for their patients too. So there may be ways to compound to get adequate levels so that you can do some of these medications too. So I would also look at local pharmacies.
And Dr. Norris?
Yeah, so some of the things that we have here at Emergence is Emergence Health Network. We have the support of the psychiatric on that side, right? So individuals that are struggling with those suicidal thoughts, they may be struggling with the depression, the anxiety. You definitely, you come to any one of our locations and be treated. We also have a integrated clinic here on the west side, and that one does psychiatric care. It also addresses the medical portion of it as well. So we have providers that are ready to serve on both sides.
And Pamela, any closing thoughts from you, tips that you might want to give women who are watching us?
I just want to let women know that it's nothing that it is something that is doable. Just, go to your doctor and get, everything tested. I know we have a lot of information online, but it's best to go to a doctor and just talk to them, and and your blood work your labs, your overall health will, show what you need. And there is, I can say there is a light at the end of the tunnel.
Yes.
And there's a lot of information out there, and in regards to insurance, there are a lot of medical doctors that do accept, the insurance. So.
Right. All right, so we are unfortunately out of time, but I hope that this conversation continues. For all of you watching at home, I hope you learned something from our wonderful panel today. If you're a woman going through menopause, I encourage you to do your research. My hope is that you find not just the relief, but also the support. To our amazing guests, thank you so much for spending this time educating us on this very important topic. So you will be able to watch a replay of this entire conversation, not just on our social media pages, but also on kfoxtv.com. We will put some of those resources that we've mentioned there as well. Thank you everyone for joining us this afternoon. Thank you all.
Thank you.